So you might be redirected from Instagram or seeing this for the first time on YouTube, but the topic here is psychosis. So I'm trying to explain what is psychosis and how to understand it and what to do about it. Simply said, it is detachment from reality. Person is believing things that are not real or experiencing things that do not exist. So believing things that are not real, it means that person is suffering from delusions. Most common are paranoid delusions, and experiencing hallucinations possibly, and those can be in the form of voices or seeing things. And also there might be, to a lesser extent or possibly sometimes very severe, disorganization of thought process and behavior. So person is, the word says, disorganized, right? They don't really act in a logical manner, and they might be speaking gibberish and being difficult to understand. Psychosis might be a symptom of psychiatric illness, and frequently is, but it does not have to be. It might be consequence of medical illness or intoxication. So number one responsibility on the side of psychiatrist is to determine if psychosis is caused by organic changes, let's say a brain tumor or poisoning or intoxication or liver failure or kidney failure or something like that, or is this psychosis that is symptom of mental illness. It's really important for you to underline this word symptom. So psychosis in itself is not a disease, it's a symptom of a disease. I want you to think about fever. So it's probably more understandable that fever is not a disease, it's a symptom. And also fever is most commonly a result of some kind of infection, but it doesn't have to be. A whole lot of other things can be causing fever. So there is this analogy: psychosis is frequently caused by psychiatric illness and indicates psychiatric disorder, but it can be caused by organic symptoms. So once organic symptoms are ruled out, then we are looking into different type of psychiatric problems that can cause for somebody to be psychotic. And there we are looking at primarily psychotic illnesses, so illnesses that go with chronic psychotic process, and those are schizophrenia and schizoaffective disorder. And for that type of diagnosis, a very serious diagnosis indeed, you need time. So people are essentially psychotic for a very long time, 6 months or more, and they are psychotic without any other symptoms in schizophrenia, or they can be psychotic and they can have depression or mania in schizoaffective disorder, but also at least 2 weeks or more being psychotic without any mood symptoms. And then there is psychosis that's induced by the severe presentation of mood disorder. So let's say somebody is depressed and they're getting very severely depressed, they are neglecting activities of daily life, not getting out of bed, mood is extremely low, and suddenly they start hearing voices. Well, that's your detachment from reality, that's your psychotic symptoms, and those voices are usually, we say, mood congruent. So somebody who is depressed is going to have depressive themes in their delusional thought content or in their content of their hallucinations. So let's say this voice is telling them that they are a very bad person, that they should die, kill themselves, or that they're responsible for some misfortune in the world. And then let's take a flip situation. Let's say somebody is suffering from bipolar disorder and they're going through a very severe manic episode. So, mild, moderate, severe, boom, severe with psychotic features. So what would be psychotic features of mania? Well, grandiosity, right? Somebody starts believing that they are a multi-billionaire. Well, that's detachment of reality. That's your psychotic symptom. Or hearing voices that they are the smartest and the greatest and they have special powers and they can read other people's minds, or something along that line. Again, mood congruent, right? Manic person is not going to have depressive content of their psychotic symptoms. And the point is that here psychosis is induced by severe mood episode, and when we treat mood episode, psychosis goes away. And that's how you differentiate from schizoaffective disorder, where psychosis kind of lingers and it's there even when there is no mood symptoms, so there is no depression, there is no mania, and there is like still underlying active psychotic process. Good news is that psychosis is very treatable. It's treatable with antipsychotic medications, and no matter what is the cause of psychosis, people respond to antipsychotic medications. So it could be bipolar disorder, it could be depression, it could be in the context of schizophrenia, even in the context of, say, drug-induced or organic psychotic symptoms. Still, antipsychotics are going to help with psychosis. And people, as I mentioned before, might or might not need to be hospitalized. Some people are, we say, pleasantly psychotic. You know, they have detachment from the reality, but they're not really doing anything about it, right? Behavior is okay. So I don't know, I might be thinking that I'm a multimillionaire, but you know, I function within my community, and aside of saying that to people, maybe being a little odd, I'm not really doing anything. But obviously, if I'm acting on it, let's say if I walk into a bank and I start demanding for millions to be paid out to me, well, you know, we have a problem. This person might need to be hospitalized. So overall, first onset psychosis is something that does require emergency room visit and workup to figure out why is this happening, and to clarify if there is underlying medical condition causing this, or is this development of psychiatric illness. So somebody having new onset mental status change is somebody who should go to the hospital, who should be seen in the emergency room. I hope this helps, and I hope that this is useful, and I hope that I was not too medical with terms and too boring with my explanations, and I wish you a great day.